We provide a single point of entry into all forms of care. Our purpose is to empower people to be at their best. We look at you as a whole person when you come to us. Part of our model is that we unpack and understand you as an individual and look to find support that meets those needs and what's most important for you in the moment. So that can include our range of nurses, community resources, psychologists, social workers, work injury management, and other various emergency services and mental health teams.
The care specialists are the first point of contact that our members will have with Sonder. Our care specialists are trained professionals. They play a really important role in our stepped care model. They're gathering essential information that informs our assessments and referral pathways.
So we're the first point of call. So people call in or they open up a chat, and my role is to basically quickly assess what's happening for this person and how we can help.
Sort of like a matching service. So we try to understand their mental health concerns, their medical concerns, if there's anything legal or financial going on in their lives. I'm able to see, okay, well, you're feeling this way. Here's what you've tried. Here's what you haven't tried. And here's the resources that the Sonder app provides. Here are the tools and strategies that I have learned through my undergraduate degree or throughout my training here at Sonder. Here are the community services and the resources that you can access on a day-by-day basis. So a lot of the time it's about directing people to what's really going to empower them to get better and to sort of take charge of their lives.
It can be higher level things, mental health, depression, anxiety, crisis type of situations, but sometimes it's just people that need to vent. Like they just need a friend. I think that's one of the best parts of Sonder is we're here 24/7, and if you just need to talk, we're here for that.
One of the biggest misconceptions is that people might come to Sonder thinking that they can only discuss maybe issues or struggles that they're having at work. People can come and speak to us and seek support with Sonder for all different kinds of challenges that they're facing that are happening outside of the workplace as well.
The privacy and confidentiality part is there where it can make them feel a lot safer to share those things. And the fact that someone's willing to open up to me like that and just allow me into their world is quite rewarding at the end of the day.
We can do so much, via a computer, which is incredible. I've had some really difficult cases, from a lot of domestic violence to a lot of homelessness. Sometimes it's really hard to go to a GP and get a referral, and just to minimize that stress and that cost for them, means so much to our members.
It's all about the right care at the right time. So it kind of does sound like a buzzword, but we mean it. Even starting at the recruiting and the interviewing phase, it's one of the core things we're looking for. It's always when I say to my managers, it's like, I can train you to answer a call. We can train people to send an email. We can't train people to be nice to people. We can't train people to care about people. The one thing they're always looking for is that empathy, and it just has to be part of who you are.
I think one of the best parts about Sonder is the people that they hire genuinely care. We're not just, like a call center or AI or robots or anything like that. Like each and every member of Sonder, we buy into the model, we buy into helping people.
The most rewarding part is hearing people feel better. It brings me a lot of energy and purpose to have a 20-minute conversation with someone and just hear the difference from when we started the call to when we end it. Through what Sonder internal pathways are able to provide, we can bring them to a spot where they feel less sad, less frustrated, less alone. We're able to change a life in 20 minutes, and I don't think a lot of people get to say that about their jobs.